breaking barriers and bridging the gaps between patients and doctors. Welcome to Brainstorming with the Docs and your co-hosts, Dr. Glenn Harrison and Dr. Kolby Condos.
All right, everyone. Welcome back to this week's episode of Brainstorming with the Docs. I'm Dr. Kolby Condos, my co-host, Dr. Glenn Harrison. How's it going, buddy?
Doing great. I like this one. This is a fun one. This is, it's near and dear to my heart. I say this line so many times throughout the week. So.
Well, I think that stuff like this is important because we see it so frequently, you know, and people, I think, oftentimes don't really understand unless they're going through these type of issues by themselves or within their family unit or their group, their nucleus of people that they're surrounded by. So I do think that this is super important. You'll have to give me some feedback. I'm wearing my headphones today because our furnaces ran nonstop. So if I'm talking like yelling into the mic or something, let me know because it's
no, I just thought it was a hearing problem. No, you're good.
No,
you're great.
No, he's losing his hearing. He's like shouting into the mic. No, I just these headphones are really good, but
I'll do thumbs down or thumbs up if we want to go louder. But this is just like
just perfect. Right
directing.
All right, perfect.
Perfect. Okay, so why is this topic important?
Well, so I think it's important because people who are suffering from like long-term or chronic health issues, they're usually suffering from more than one. In our experience, I think that people go, oh, it's just this, or it's just this. And I think that that's part of the problem with our current healthcare system is that we've tried to compartmentalize and put everything into nice, neat little check boxes. And it doesn't usually work that way. When you have more than one thing going on, it increases the complexity of the case, right?
That's right.
And it makes them harder to manage when you're looking at, okay, we have this and this and this. This is how this system plays into this. This is how, the whatever it is, whether it's, blood chemistry issues or, our whole body is a body. It's not just your cardiovascular system, just your integumentary system. Like everything is interconnected.
That's
so you
right.
can't really influence one without the other. So it really does make it a little bit more difficult when you look at when you have more than one system being affected or more than one issue.
Yeah, that's true. So part of the reason for the oversimplification is again, I'm repeating what you said, but you can't fit the disorder in one box. And if it is put into that box, well, then the symptoms can't be corrected. The disorder can't be corrected because it's overflowing into other boxes, if you will, and simplifying and say, this is it, this is the box. And then the patient doesn't get any better. And I truly believe the oversimplification of chronic health issues is the biggest burden that we're seeing in modern day hyper analytical medicine.
I think that it makes a patient feel a certain way about it, right? Well, it can't be this because that would mean this and this and this, and you have this and this and this. So then it really undermines what the patient is feeling, and it mitigates kind of what they're feeling, what they're experiencing. And so when you try to oversimplify things, not only does it take away the patient involvement, but also how they feel about it. It takes away their confidence that they're in the right place. It takes away they lose hope, and we talk so often about how important hope is, especially with like chronic illness.
That's right.
You want to give someone poor outcomes, or you want to drive away patients or drive away the people that can help you. Just take away their hope.
That's so true. And the oversimplification of health issues, and we've got a couple of examples farther down what we're going to discuss, but it oversimplification doesn't give a reasoning for the problem, right? It's like, okay, why is your tire? I have a flat tire, mechanic. Oh. Mechanic says, oh yeah, it's flat. And then the owner says, well, why is your tire flat? Well, because it's flat.
Because there's no air in it.
Because there's no air in it. Okay. So then, hopefully the tire gets fixed in that situation. It should be able to. And then,
it could be a whole host of reasons, right? Then the owner have a bad bead on the rim.
Yeah. The owner doesn't have any sense of empowerment of the why or the understanding of it. So they can drive their car around wondering when the tire is going to go flat again. There's no context. Right. So they just have flat tire syndrome. And, okay. That's it. But who knows? Maybe there's all sorts of other things where the tire keeps going flat. So that's maybe a bad analogy, but nonetheless,
I don't think
so. Okay, I'll take that. So why is oversimplification so common? I said one is the question why is not being asked, and so you can simplify a problem if you don't have to answer the why. So that's one reason. What are some of the other ones that maybe got embedded in our current medical institution?
Well, I think that if the problem's simple, then the treatment or the management can also be simple.
Mm-hmm.
You know what I mean? You have this, you take this, or you do this.
Mm-hmm.
So it really does make it less labor and time intensive. Yeah.
Less clinical thought process if it's check a box and fill it in. And sometimes the boxes work naturally.
Yeah. Yeah.
But chronic illness, it tends to not. Broken bones.
Right.
Yes, of course. Also, if there's less clinical thought process, there's less investment of clinical time, and therefore it's more cost effective. So the insurance model loves the check boxes.
Yeah. The X equals Y. You have this, you take this.
Yeah.
Next.
Mm-hmm. That's right. So a lot of times it's a standpoint of cost and also standard of care. We've talked about this before, where if you have this symptom, this is the protocol, and this symptom, that is the protocol, or this, and naturally you should be able to go from one doctor to another, and it's uniform. It's always the same, which it's good from an efficiency standpoint, initial efficiency, bad from a patient experience standpoint, because everything is cookie cutter. Everything is protocol.
Right.
And unfortunately, that's just not, we were just talking about protocols. It's not necessarily the way it goes.
Yeah.
So what are some examples? And I know you put these together, the examples of oversimplification. And I really like these ones.
Yeah. So when we've beat this thing to death. And if you have this, then you have ample amount of resources, even on this podcast, that you can go back through and listen to. But like one of the big ones I see is thyroid, right? Mm-hmm. I had this yesterday, actually. Patient came in there like, today. Yeah. I mean, it happens so often. Yeah, I have a thyroid issue. And I was like, oh, what is it? Well, it's weird because, I have hypothyroidism. So my thyroid's low, and they keep adjusting my medication because it seems like it either is too much or not enough. And it can depend on the month. I'm like, okay, so that's an oversimplification because they didn't. And I asked, what labs did they run? They didn't run a complete panel,
mm-hmm.
but basically is if your thyroid is low, like if your TSH is high and your thyroid is low, they give you more, right? Mm-hmm. That's an oversimplification. And when you can look into it, and there might be thyroid autoimmunity or whatever else. If you have questions on that, listen to the previous podcast. We did a 2-part series on that.
Yeah, we did. Yeah. 2 or 3. I want to say 2 or 3.
Remember.
Anyway. Yeah. There's a lot of information, and ultimately what we're trying to say is the thyroid is much more complex than one lab test and one drug
pill. Yeah.
One pill.
Same thing with cholesterol.
Yeah. This a beast.
This one's like a pet peeve of mine, to tell you the truth.
It actually I think my blood pressure went just up higher just talking about cholesterol.
Right?
No pun intended.
Yeah.
Really. Mm-hmm.
If it's high, then you take a pill to lower it, right? To shut the production off in the liver. You've used the analogy that's like a cork, right? You take a pill, it like corks the cholesterol in the liver and doesn't let it out.
That's right. I remember we talked about this on our cholesterol podcast. I'm sure.
Right. There's a whole nother one. Yeah. If you guys have questions on that, listen to that one. That doesn't ask the why, right? We just talked about asking the why of chronic health conditions. Why is your cholesterol high? There could be something as simple as like, well, it's genetics. We've looked at your diet. We've looked at your exercise. We looked at what you're doing. And there's a point where it just is going to be a little bit high. And maybe then we use a pharmaceutical. We've explored every other avenue. But you always want to investigate it and make why is it truly that high? And that's when you have to look into other aspects. Is it diet? Is it exercise? Is it genetics? Is it something else that you're missing?
And the oversimplification in many cases with chronic issues, is this all about chronic, not acute conditions, but the oversimplification creates a perception that the strategy, the Band-Aid is right. But very seldom, if you have like a cut, it's the bleeding, and you want to stop the bleeding, but like a cholesterol issue, you take a pill, it might bring down the lipid number, but there's still all the other underlying disorders that are going on that you're just kind of, you're just polishing up the window, but there's still problems on the other side of the window. It's not fixing the source of the problem. There's all this underlying stuff that is still raising havoc on your body. And I think that's one of the big dangers of the oversimplification of chronic illness. Short-term efforts seem simple and financially efficient for the insurance companies and the medical organization, because they get them in, they get them out, they change the lipid number, but they're going to be back in 3 months with another health issue. And then if there's nothing else done other than a cholesterol, there's higher risk of heart attack in a year down the road, or there will be a heart attack, or there will be one stint, and then there's going to be another stint, and there's another stint if the person lives. So short-sighted oversimplification of a chronic illness leads to a long-term problem. It's going to lead to a long-term problem. And it's kind of like, I change your oil all the time in your car to prevent engine failure down the road. It might take a little more time changing your oil than just whistling past the mechanic shop and not doing any maintenance.
It's fine. I put a fuel treatment in there.
but it will bite you in the butt later. It will bite you in the butt later. So fibromyalgia is another one. It's a diagnosis of, the symptoms are localized pain symptoms with emotional challenges, also called, some people, they kind of brain fog, they'll call it fibro fog and all that. But there's only one solution. There's only one strategy. It's pain meds. But that's not the problem. It tends to be an immune problem. Control the immune system and the symptoms go down. So once again, oversimplification. Give it a label, give it a drug, call it good. But there's just going to be reoccurring visits, medical visits, or
they're going to feel like they're not being managed well, right?
That's true.
Which takes away their empowerment. They don't feel like they're being managed the most effectively. They feel like they're still having symptoms. They feel lost. They feel hopeless.
And maybe that's because it's passive care, right? If they're not part of their care, how could you feel empowered in your care? Mm-hmm. If it's active care where you're involved in it, involved in the decisions, involved in the action steps, involved in the therapies, involved in the treatment, meaning doing something about it and being properly guided, you take ownership of your wins or your challenges.
Right. So I call it diagnosis audiosis, right? It's like, this is what's wrong. This is what we're going to do. See you later. How good do you feel about that? Not very good,
That's true. And there's so many others like, or IBS. Well, what are the strategies for that? Well, not much. Or there's no explanation of the source of the disorder. It's oversimplification for a digestive problem that's an irritable GI.
It's a catch-all, right? No,
yeah.
It's irritable bowel syndrome. Well, my bowels are irritated, but where did it come from? Well, we don't know, but that's what it is.
That's right. Yeah. And there's this oversimplification of chronic health disorders. I've been picking on the medical system, or we both have, but it happens on both sides of the aisle.
It can 100%. It can 100%. Oh, you have a issue with your SI. Well, why? Well, I don't know. It's just it's a issue with your SI joint. Mm-hmm. Yeah, but you didn't answer why. Well, I don't know. And to tell you the truth, sometimes you won't know. And that's sometimes you can investigate it and do your due diligence and try your best, but you won't figure it out. And it's on both sides of the aisle too, But
like green pharmacology, where you got these natural doctors just throwing vitamins at every ailment there ever was. And if that's the only solution, there's no question to why either. It's just, instead of a pharmaceutical, it's some kind of vitamin.
Swapping one Band-Aid for another one.
Mm-hmm. So it happens on both sides of the aisle, and the oversimplification solution for a problem is very attractive for all of us, right?
Yeah. It's easy, it's fast.
Yeah. And it's attractive for both the patient, if they believe it's going to work. And it's definitely attractive for the provider, because they don't have to pour into the case. They don't have to get ownership from the patient to do what they need to do. So it's kind of like that forbidden fruit that both parties want to take a bite out of. And
everyone wants the silver bullet, right?
It's great until everybody has a sour taste in their mouths and hate each other. And then it's not only, okay, there's no solution to the problem. There's emotional burden of another time something didn't work. And I think that, in a nutshell, is the biggest problem I see with the oversimplification of chronic issues. is the hope that is lost with the effort that is put in.
Yeah, I would agree with that.
I really, really, really feel that.
So when we were outlining this, we also talked about some other podcasts that you guys might get some value out of, because they kind of tie in really well with this specific topic.
Yeah.
If you go back through our library, we reference the thyroid. We have a couple thyroid podcasts.
Mm-hmm.
We have ones on adrenal. We have one on cholesterol. All those would tie in really, really well with these. But I think the biggest one for at least myself, when we were talking about this, I was like, we did one on junk medicine, and it really kind of dives deeper into, why
How
what we're
happens.
doing. Yeah. And why what we're doing in certain situations and circumstances is just not maybe the best practice. So that one would be a really good one to reference as well. If you guys would like to get a hold of us, or if you have a topic or a question, you can always get a hold of us at info@brainstormingwiththedocs.com. You can find a lot of our information on our websites. Mine is northlakescheropractic.com. Dr. Glenn's is drgharrison.com. And turn on notifications, hit like and subscribe, because we're going to continue to roll out new content each and every week, whether that's a guest or a new topic.
That's right.
And you never know when we might roll out something that's applicable to you. So,
Well, that sounds great, Dr. Kolby. I like this one. I always like the philosophy and the understanding and the psychology of health and care and motivation, because those are ultimately the keys, I believe, that both sides of the aisle have challenges with. And if it's not put out there and there's not enough awareness about it, both sides of the aisle, the doctor and the patient, don't build the relationship they need. And it just causes a whole bunch of problems for everybody. So I'm glad we're knocking this stuff out and hopefully creating more awareness to these potential challenges. So
yeah, I absolutely agree. So
all right,
buddy. Till next time.
Sounds good. We'll talk to you next week. Bye-bye.
Bye-bye.